All right. Well, welcome everybody. It is now 2 o'clock my time. So we will go ahead and get started. I'm super excited for y'all to join Elizabeth here today as she goes over grant budgets and gives you a bit of insight in her knowledge on grant budgets for your organization. So I'll introduce Elizabeth Burrows. She's an alumnus of North Vermilion High School and graduate magna cum laude from DePauw University with a degree in political science and communications, where she studied abroad at Oxford University. She went on to receive her Doctor of Jurisprudence from Indiana University Maurer School of Law. She has worked at the Indiana State Department of Health as the director of the State Office of Rural Health, where she more than tripled the amount of federal funding for critical access hospitals. Elizabeth then returned to Cayuga, her hometown, to start up and serve as founding CEO of the Valley Professionals Community Health Center, which grew over 1,000% in the 8 years she served as CEO. During that time, she started the first mobile school-based health center with leadership from Senator Lugar and his staff to serve rural schools, and was selected as a leader in the CMS Practice Transformation Project, leading her health center to become a nationally accredited Level 3 patient-centered medical home. In 2014, Elizabeth started her own business, Burrows Consulting, where she has assisted numerous rural health clinics, federally qualified health centers, institutions of higher education, critical access hospitals, and other nonprofits obtain over $140 million in grant funding and over $100 million in enhanced Medicare and Medicaid reimbursement and 340B shared savings. She has worked with healthcare facilities in over 32 states and has created over 15 new federally qualified health center entities. Through her consulting business, she also has served as interim CEO for entities seeking FQHC designation. She now resides in Vermilion County, Indiana, and enjoys spending time with her husband and daughters, Eleanor and Amelia. They love traveling, going to sheep shows, visiting historic sites, and more. I'm super excited to have Elizabeth here today to talk through grants budgets, so I'll give her the floor now.
Thank you, Hannah, and thank you for attending. I'm going to tell you, this is the hardest part of grants, in my opinion, because I'm a word person. As you heard, I'm a lawyer, so I like to write with a lot of words and make my case as to why you should fund me. So this is something that I have had to learn, in some cases the hard way, because I had to manage grants at the Indiana Department of Health, and then also as a CEO of 2 separate federally qualified health centers. And in that role, I was the person responsible for those grants. So as many of you on this call, a few names I recognize, I know that you too are the people responsible, and we want to do the right thing. I will tell you today is kind of how to with our grant budgets and how to be prepared to receive a grant. And then I believe later this summer, and Hannah will be sending out that information, we're going to do one about how to properly track grants and how to make sure that you have all your ducks in a row. So now that we've received a grant, how do we do everything right? But today we're going to focus on, again, just getting started, attaining that grant, and making sure you're ready and prepared to receive funding. And as we all know, sometimes the word budget is a little bit scary. I know personally, working on my own household budget is oftentimes something that we put off or we don't want to do. But again, grant budgets are oftentimes the most important, and you need to make sure to pay attention to them at all times. Feel free to put questions in the chat and ask questions at any time. I know I talk fast, and I want to make sure that you understand everything we're saying, or you can unmute your line and interrupt me. We will be recording this because we did have many people who had things come up today. Seems as if it's been a crazy month for people, and so we want to make sure to be able to share this with people that were unable to attend. And also sometimes a few months later, I end up sharing these things as well. As another note, if you have a webinar that you would like us to offer, please put that in the chat as well, or email that to Hannah or I. We would love to hear what you want to learn about. So please share that with us, because we were actually just planning out our summer and fall webinars. So if there is a topic that you want to learn more about, we would love to provide that for you. So, okay, we're going to get started here. So the first thing is, oh, Liz, you're speaking my language. You and I are always on the same page, and we actually have NOAs on the slide. So we're going to talk about NOAs today. And if you don't know what an NOA is now, you will at the end of this presentation. So short version, why am I doing this workshop? What do these 2 pictures have in common? I think you probably all know the bottom photo and what that is, but you probably don't know that the top photo is actually my county library that did not have internet or computers in the year 2000. Why am I doing this workshop? Because as a summer job, I worked for USDA Rural Development, also a great grant funder. And during that time, I was able to apply for my first grant for my hometown to bring internet and computers to all of our local libraries. And I wrote that to a little known foundation at the time called the Gates Foundation, received my first grant. And ever since then, I've been addicted to grants. And so again, that first budget, I will not ever forget, put computers and internet in there were at the time 5 different local library sites, but that still is the library that I go to. I was at the book club, just this week, actually going to the library and participating in that. And you saw a lot of people there using those computers that now have been updated, and the internet there. So again, this is why I do what I do. Okay. Just totals, just so you know, I'm not making this stuff up, but since 2014 with my business alone, we've helped over 125 clients bring in over $140 million. I think this year alone, we're at about 40 million year to date, and we're anxiously awaiting a lot of grant announcements that should come out at any time. If you don't know what these agencies are, these are all federal agencies and federal funders that I've worked in grants with. And again, we've worked with over 32 states, and we also are writing many state and local grants. If you want to pay attention, definitely look, because many states are putting out potential grant opportunities for the opioid settlement funds, and we'd be glad to assist you with that, or definitely look up your state or states that you serve and check for that funding. So again, just proving, yeah, we've done this a lot, and we've worked with a lot of different budgets and people. So again, what are the goals for your grant writer and for each organization? You can't go into it thinking, I just want to get a bunch of money. And you also can't go into it thinking, I just want a bunch of money to pay for all the things I already do, and I'm not going to think outside the box. That's going to be very difficult for any grant that you're looking for. You have to think, what do we want to achieve, and why do we want to achieve it? Do you really have a passion for getting healthcare to rural areas? Maybe a mobile clinic is something you would be passionate about. Again, Santa's wish list. You have to have your wish list, your organization's wish list ready. Money can't be the reason. You have to have other things that you want to be the reason. Do you want to bring internet to your local schools? Do you want to earn funding for your daughter's band trip, like I wrote a bunch of grants for in the fall? Do you want to really impact and improve primary and behavioral health care throughout the entire country, or throughout your county, or throughout your town? Those are things that are why. You know, for me, my why is typically I want my daughters to receive the best possible health care that they can. And for me, that's at an FQHC. So I want it to be the best FQHC, and I want everybody else's children at their FQHCs to have the best care, or RHCs, or critical access hospitals. But again, you can't just say, I want money, so I'm going to go after grants. That's not the right reason. You need a true why, and you also need a plan. So again, that's your background. That makes budgets a lot easier, let me tell you. So again, just thinking of grants, what do you think of when you hear grants? What grants have you been involved with? Who's in charge of grants in your organization? I'm just reminding you, because if you're on this and you're like, well, I'm a CFO and I don't even know who is in charge of grants at my organization, and you would be surprised how many times I have heard that. That's a true story. Or, oh, we have a grant writer. I didn't even know we had a grant writer, and I might be the grant writer. It might be someone internal to their organization. Make sure you know who is writing grants, what they're doing, and that they do have a connection with your finance department, or the people overseeing your finance and your audit. Who is in charge of grants and who's in charge of the grant budgets? You want to make sure that you know that, not only to complete the actual grant submissions, that's really important, but also just to make sure that your whole organization is speaking. You have no idea how many times I have been called to say, our organization has a grant, they've drawn down all the money. I have no idea where they spent the money. And that scares me, and that gives me cause for anxiety. And it happens not often, but I would say I get that call about 4 to 5 times a year. Or I'm at a conference and it's always at a conference, and someone corners me and they're always like, can we chat? And I'm like, of course. Well, we got this grant, but we didn't track anything, and we're not for sure if we got the money. We think we did. We don't know. True story. Last week, I had an entity say, you got us these grants, and we haven't even been given any money. When I went to the funder and reached out, I found out they had been given hundreds of thousands of dollars. But again, the people running the grant didn't even realize they had actually been paid hundreds of thousands of dollars. So when you say, Elizabeth, this is basic, I don't need this information, I'm just telling you, these are real life situations. Hannah can attest last week, that was a true story that happened. that an entity said we can't even get our money that has been awarded, and then I find out they've already had that money put into their checking account. And these are very capable organizations. I'm not talking about, when I talk about money in my daughter's band trip, yeah, that might be a little harder to track. That's a very small nonprofit, or you're getting a grant for your local Lions Club, or like the Ernie Pyle board I'm on that I'm going to write a grant for this summer for his museum. Like those types of things might be a little more difficult. I'm talking about large healthcare organizations that go through annual audits and have been in existence for long periods of time. So again, just keep in mind and be on top of this. We're getting to the fun stuff, Liz, I promise. These applicable federal requirements, I say this, I'm a lawyer, so I like to know the law. For people who want to look up stuff themselves, they don't want something off of a slide. This is the law. These are your rules. This is what governs federal grants and meets your federal requirements. So again, if you are a healthcare entity and you're getting maybe a private nonprofit grant, but you also are getting Medicare or Medicaid dollars, you still want to make sure that you're trying to be a part of all this. Within this law, you can find the pre-federal award requirements, post-federal award requirements. You can go through this and figure out exactly what is needed. But again, this is the law if you want to look it up. This governs your state, local, tribal organizations. Also, people forget this. A lot of times there are federal grants that flow through the state or through the counties, and then they come to your healthcare organizations. I can almost guarantee without even looking that it's going to have this language within the contract that you sign with your county government or your state government that you're following all this. You may never even have seen it. You may say, I don't know, it's not there. If you can prove to me it's not there, I'd love you to reach out. And I tell you what, I'll send you a gift card to Amazon or Starbucks. Okay. If you can prove to me it's not there, because I bet you any amount of money that it is there, and you've got to follow that. So again, this is where you want to go if you really want to read the laws, or if people are asking you, these are the actual requirements. Google that 45 CFR 75. I've Googled it numerous times to check different things. Thank you. And again, grants management, just a reminder, this is kind of once you've been awarded. If you were one of the rural health clinics that was on some of my webinars with me last year when rural health clinics got grants for the first time, yay, we went through some of this stuff. But again, we're following the yellow brick road to get the green, get the money. You have to make sure you're set up in the payment management system. If you're in a organization and you leave, or somebody you know leaves that's in the finance department, make sure that new person is set up. Make sure you're handing that off. If you're the grant writer, you need to know who's drawing down the payment management system. Those two people usually aren't the same, but make sure you are communicating. Make sure you're tracking how you, not only how you plan to spend the funds, but how you actually spent the funds. Make sure you're submitting your FFR report, and review your notice of award. So as that was put in the chat, an NOA. If you haven't heard of NOA, it is a notice of award. Make sure you review that. We're going to walk through one during this presentation, but I can't say it. I'm going to say it again. Review your notice of award. And this goes with any federal grants, call them NOAs, notice of award. But with any award you get, you're going to get some sort of letter, contract, agreement. That is not just, I'm going to sign it and file it away and never look at it again. Or I'm going to file it and lose it. Or I'm not going to sign it. That's happened to me too with clients. They get an award, they fail to sign it, and then the people have to chase them down and maybe take the award away. But make sure you actually read it. It's very important. There are different stipulations put on grants. For example, a grant for my daughter's band, they got a $5,000 grant, but when you read the fine print, they could get another $5,000 if they got businesses to donate another $5,000. The foundation would give them $10,000 total. That was not in the original award, that was on the second page. Had I not read that, my daughter would have lost out on an addition, all that extra money, not only $5,000 from the foundation, but it was easier to go to businesses and say, hey, will you give 500? Because the community foundation is going to match it. People love that. So if I give 500, they know 1,000's going there. So read every bit of your awards, the letters, and the information that comes out. Be ready at all times for a financial management review. That's what our federal government calls them. United Way has different things they call them. They call them site visits, site reviews, budget reviews. But again, just make sure you pay attention. Most of the time it's a virtual review. You have to see policies and procedures. Respond to HRSA when they email, or any funders when they email. I had a funder email me yesterday for a client. We have to do a report on the racial and ethnic diversity of the staff. That's now required. That was not required when we received the award. Now we have to report that. Some of you got money, you have to report how many COVID-19 tests and shots you're doing every week. Even if it is 0, put in 0. You have to respond. You must be responsive at all times. So again, just looking at your budget, I'm not trying to scare you. I want you to go after grants and get a lot of money, but you need all this stuff in place before you're doing your grant budget. I'm going to just run through these quickly. These are for you guys to have. They follow the 45 CFR 75 codes, but you definitely need a plan for cash management and how you're handling that. This is focused on rural health clinics, but you can adapt it to FQHCs. It's really easy. You can adapt it to critical access hospitals very easily. This past federal government muster, I had a lot of clients that had to go through the financial management review. Make sure you have these policies in place. If you're a hospital, make sure they pass your hospital finance committee or board, whatever is needed. If you're an FQHC, they need to pass your patient governed board. If you're an RHC, they need to be put in that master binder for people to see. Make sure you do have these policies in place. We're going to go through them quickly, but again, you will get these slides afterwards, so you can just cut and paste and use these as needed. So you have to make sure you know how to manage the cash that you've been given and that you're allocating appropriately, that you do have an accounting system, you know, that you, if it's QuickBooks, you're using QuickBooks. If it's MIP, you're using that, Sage, whatever. Make sure they know what accounting system you're using and that you do have the appropriate methods to account for costs and records at the end of each month, quarter, year as necessary. You have to have a plan for how you're going to do disbursements and procurements. If you are bidding things out, that you're getting the appropriate bids. Anytime you're using federal dollars and even local and foundation dollars, state dollars, there's different things you have to do to make sure you have all of these things in place. These are policies you should have, or plans in place. Again, this is more for you to work on afterwards. If you have questions, feel free to reach out, because I could talk an hour about each of these things, and we're trying to get to talk about grant budgets, but I can't talk about budgets unless you have the foundation in place to be ready to receive that grant budget. Timekeeping. So I will tell you the best way to spend grant money is salaries, staff salaries, pay staff, pay staff, pay staff. Don't try to go buy land or a building. All that stuff is hard, or a car. You have to track that forever. Then there's a notice of federal interest. There's all kinds of complications that can go with that. The easiest way is to pay staff or pay contractors every time. But again, you do have to do proper timekeeping and tracking of that. So make sure that you're fulfilling that and that you're following your own policies. But again, if I can tell you, I will repeat myself 100 times on this. If you can ever pay staff out of a grant, that is always the easiest thing to track, to do, to maintain. And it usually makes that's what most grants are set up for with the federal government. Yes, there are certain federal grants, especially through USDA, where they're going to buy a mobile clinic, where they're going to put up a building or a fire station or emergency equipment. And that's fine too. That requires different tracking. But when you have the freedom to determine how to spend money, always spend it on salaries. And again, for most nonprofit and for-profit organizations, running healthcare organizations, what's your number one cost? I can almost guarantee what your number one cost is, and it's going to be employee salaries or contractor salaries. Make sure any costs are allowable. These are the federal rules of where you can't spend money on, but again, sometimes there are other rules of things you can't spend money on. I'm trying to think of different examples, but I had a client get money from the NRA for a bunch of gun safes, but they had to be a certain level of safety from the gun safe. So they had rules about, what gun safes it had to be. There are some grants that, for example, that you can get grants to get free mammograms for patients, but those women have to be of a certain age and of a certain income level. So again, there are tons of rules around making sure your grant costs are allowable. And for each one, you'll want to read those rules to make sure they are allowable. Specifically, there are limits against how high you can pay a person. They can't make more than executive level 2 if it's federal funds or state funds that are actually the state flows through the federal funds. There are limits, and it's somewhere around $205,000. I always Google it because it does change at different times and every year. You're going to say, well, I've got a psychiatrist that's making more than that. That's fine. You have to adjust that down and make sure you follow appropriate rules. So again, and if you have an organization that lobbies or goes to the state house, make sure you're not paying people that day. It's cleaner and easier. So again, just make sure whatever you're doing that it is an allowable cost. And then again, this is the short version. It has to be necessary and reasonable to carry out the federal award, consistent with your policies and allocable to the grant. So I'm going to give you an example. There's certain grants for maternal and child health. It would not make sense to put an internal medicine doctor who doesn't even see any women and children and only sees males of a certain, 50 and over. You would not allocate him to a maternal child health grant. You need to make sure whatever you're allocating is appropriate and you are tracking that. If you buy a car for patient transportation, that car is only for patient transportation. That car is not to boat the CEO to lunch with their friends. So again, just making sure everything is allocable and necessary. And Hannah, it looks like we've got some comments. I don't know if you want to share those.
Yep, I was just about to jump in. There is a comment about Ryan White programs have extremely strict budgets. So if you're a Ryan White grantee, you might want to look at that NOA extra, look at those rules for you. And then a question did come in: if you have multiple grants to adjust salaries, can you use them against balances remaining after the executive 2 salaries? For example, can you pay them $102.93 an hour from the grant and the remaining $36.95 hour of a physician to another grant, or is each hour considered fully allocated regardless of remaining balance?
That's a hard question. I would think what I would advise my clients and what I would do is I would probably just pay the rest of that salary out of income that physician generates and not out of a grant, because technically you're saying a 1.0 FTE has already been allocated. And that's important too. If you have half of my, and this happened a lot when I ran FQHCs, I had a third of my salary paid by a state grant and half my salary paid by this federal grant. And you can't have more than a 1.0 FTE being covered by a grant. And we never wanted, because I did meet with state and federal legislators, even though I was educating and not lobbying, we never put more than 0.9 of mine, because I did use a little bit of time just to make sure that's perfectly clear. And just to make sure everything is clear, I would not allocate grant. Again, that's where you can use program income or other funds to cover that, is usually cleaner. I don't think it's wrong to do what you're saying, as long as the other grant allows for that and it's not another federal grant and it was like a local or a state grant that is not federal dollars and does not have those rules. I think you would be okay, but just for being completely clean and upfront, I probably would not do that. And it's also important, if you are paying an employee by a federal or state grant, make sure they know that. They should know that, and that should be on their timesheet in some method or some reporting mechanism. This should not be, oh my gosh, I'm paid by a grant when somebody says it. I thought I was paid by, I don't know, the hospital, just the hospital general funds. I had no idea I'm a community health worker and I was covered by a grant. No, they should know that. It's not a problem. This is something we can still sustain. You don't want to scare people, or they think, oh, it's just for a year, I'm going to get fired. It's not like that, but it's just so they do understand what is happening there. And keep in mind too, there are certain rules. Sometimes they have to be checked on the OIG exclusion list. Some grants require that you have certain vaccines. Some require certain, skill sets or whatever. I mean, again, If the grant says it's for a bilingual nurse, it should be for a bilingual nurse. We can't have someone who only speaks English like me and doesn't speak other languages, making sure that it is for what you say it is. Okay.
Perfect, thank you. And again, if you have questions, keep putting them in the chat and we'll keep doing this, but we'll move to the next slide for now.
More about allowable costs. And again, this is just making sure you do what you say you're going to do. So, all right, here's the fun stuff. You guys had asked for some examples of budgets. This is straight from a grant budget that I wanted to share for you. And being as detailed as possible, this is actually a foundation grant, but it could also, or a federal grant, it would be the same. This is federal requested funding. I think we changed it, but it was also for a foundation. You want to be as detailed as possible. And just so you understand, you put usually the position, the name of the person. If you have not named them, but you're going to use this grant to hire, write to be hired. And most grants do require a job description. And then the percent of FTE or full-time equivalent, as we've been talking about. So this would be a 0.25 FTE. So approximately 10 hours per week. I know some people are moving to the 4-day work week and all that, but typically we think of that as a 10-hour-a-week position. And then looking at the annual salary. So again, all the annual salaries are below the limit, the over $200,000 limit, so they can be requested at the full salary. And this would be what we are allocating. So in this case, all these people would be allocable each position. You would again put the name, I removed those, and then what their full salary is and what you're putting into the grant. This particular budget request does not include fringe benefits, but it can. Usually fringe benefits are a certain percentage, and I've seen anywhere from about 10% to 35%. Typically, I will say the 25 to 30% for fringe benefits is the sweet spot, but you'll want to look at what your costs are, and that is difficult and stresses people out because sometimes they'll tell me, well, but this person doesn't take insurance, and this person does take insurance, and then this person takes family insurance, but this person doesn't take dental. It doesn't have to be the exact cost. It's overall what's allocable to your organization. So again, I could say, Hannah, it doesn't matter if Hannah takes the insurance or not. If the overall cost of the organization is 25% of salaries, that's what we would include. I wouldn't look up specifically what Hannah takes or doesn't take, if she's married or not married. We can't go with that. We have to look at an overall cost on that. And then for this, it was PPE. I did use PPE because that was used in the grant. So that is an acronym, but it was understandable how much we're spending on that. And then office supplies. This one, office equipment. This did not ask for more specifics, but sometimes I would actually put how much laptops cost, scanner, printer, and supplies. I would divide that out in the parentheses. And that's what you would go with. And then you have a total budget. You always want to ask for, in my opinion, as much as what they'll give you. So I always hate when people leave even a few dollars on the table. I want my clients, if there's $1 million available, I don't want you to ask for 920,000. I want you to ask for $1 million. In this case, this was an odd amount because the client was told by the federal government how much they could ask for. You always want to check your numbers, and I will tell you, check, even if it's given by the funder or by the federal government funder or anything, check those Excel spreadsheets, because just this year we found a foundation Excel spreadsheet error and a federal government Excel spreadsheet error. So you think, hey, they gave them to us, but that doesn't mean all the formulas match. You'll want to add it up and make sure everything is set up accordingly.
Perfect. We did have a question come through that kind of relates to what we've been talking about with budgets and salaries. So I'll go ahead and ask that now, if that's okay. Is there a minimum wage that should be paid and included in the grant? For example, would someone in a budget need to be paid at least $15 an hour?
Yes, I don't know that there are rules about that. There are certain requirements if you're doing like a building project and you're getting the facility funded, you have to do Davis-Bacon wages, which means you have to do the living wage standard for projects funded by federal dollars. I don't think we've gotten there with typical salaries, but I would definitely say we're very close to getting there. And I would think if you're paying medical assistants, $11 an hour or something, that would cause a red flag because that's just below the standard. So you would definitely want to look at what are the standards for people and make sure you're paying that accordingly. There are differences based on different parts of the state and country. People understand that. But again, you want to make sure that you are paying adequate salaries. Same thing. This is very minor, but it is something that people like to hear about. You have to watch this. This budget does not include travel, but if you do include travel in your budget and it's a state grant, you have to use the state mileage rate. If it's a federal grant, you have to use the federal mileage rate. Same for hotels. Sometimes the state puts a limit on hotels. Sometimes the federal government does. That's dependent. And again, if you are traveling by plane, there are a lot of federal grants that require you to go to certain conferences. They expect you to fly, what do I want to say? Coach or just regular class, you're not flying first class, business class, fancy. See, I don't even know what to call it. It's what I just fly. Sit in the back of the plane and get there as quick as you can, the cheap seats. So that's what they expect you to do. Also, alcohol is never an allowable cost on any budget that I've seen. And oftentimes food is not allowable. It can be, that depends. You have to follow your per diem rules. I have had people really upset with me when I ran organizations, and even now I haven't had too many mad, but definitely when I was a CEO, I had people mad because they were paid out of a state grant. And at the time, the state rate for mileage was like 40 cents versus the federal rate of like 57 cents. And so people were really mad about that 17 cents in gas. And again, I didn't choose that. That was the requirements of the grant. So you want to make sure to watch that and you're putting them in the budget accordingly. Now that's also up to your organization. If your organization, sometimes after we had people upset, we just paid the difference. We only claimed the 41 cents or whatever to the state, and we paid the 16-cent difference to make it easier for employees and not to feel unfair. But again, you'll want to watch any requirements. And you're thinking, Elizabeth, you're literally counting pennies now. Yes, I am. And make sure, you're doing it appropriately. And again, it's a reminder, any of those things, like if you're paying for a car or travel or whatever, it is just travel for the grant, not just for your organization. So again, if the grant is to do outreach services in one county, and sometimes that happens, but you have to go to 4 counties, you can only count your mileage in the one county. So again, just making sure you're aware of that. Also, this is exactly why it's easier to pay salaries of people, because this is a lot easier to capture. Or again, laptops, minor office items and things like that, because it's the easiest to track and capture. Okay. This is an example budget narrative. And most of the time we do go with budget narratives. You have a budget and you have a budget narrative. These two are not meant to match. They are separate. Don't tell me, I know that they don't match. I'm doing 2 separate budgets for you just to show you. But again, you usually have to explain, this is what we want in year 1, and making sure you do address each item. Even though we put travel total 0, I actually write, we are not requesting any funds for travel. Be clear about that. If you just leave it blank and don't even address it, and all I put in was personnel and supplies that we're asking for, then they don't know, are you asking for that or are you not? Did you even address it? Yes, no. It confuses people. So my theory always is actually put 0, put not applicable, or I actually usually almost always write out, we are not requesting funds for this. We are not requesting funds for this. No funding is requested. So it's clear that you've seen it, you've addressed it, and you're not dealing with it. Indirect charges. Indirect charges, oftentimes you can ask a de minimis rate, which is 10%. Otherwise, if you are applying to federal or state, you need to have, or governments, you need to have that on file. So many universities are great examples. They have an indirect charge rate, which covers what their overhead or the electric bills and things like that. And that would be on file. You can only put what is already been filed. You can't say, oh, well, I know that we have to pay so much more to add these 3 staff, so I'll just put it in indirect, even though you have not filed that rate. No, you cannot. You can make potentially, if the grant allows, put it in a de minimis 10% rate. SAMHSA grants usually allow for that. Some other federal grants allow for that. Some will absolutely say, no, we cannot have that. So pay attention to that indirect rate and whether you can do it. You also want to make sure, as much as you can use the NOFO or Notice of Funding Opportunities language, you use it, you address every category. If they call it personnel, you call it personnel. If they call it staff, you call it staff. If they call it supplies, that's what you call it. You know, you want to use the same types of things. Equipment is anything over $5,000. Supplies are anything under $5,000, and that's individual items. So if you buy 5 computers and that you're going to say that's over $5,000, no, each computer was not over $5,000, so that can still be a supply. If you have equipment, there are certain tracking requirements usually for any grant, so make sure to pay attention to that as well. Okay, I think that addresses it. Here we go. This is the fun part. We're getting to our notice of awards. And so all of a sudden, out of the blue, and it usually happens on a Friday night or a weekend, you get in the middle of the night this notice of award, and it looks like it's from potentially spam or someone bad, or it might even get put in your spam or quarantine folder. And oh my, yay, you got a grant award and you're so excited. This should be very similar to what the first page looks like. And it will have each category. So again, you have your approved project and budget period. Do not be surprised if they they give you notice of award after the date of the grant has already started. You don't know how many times I'm already 2-3 weeks into a grant and they send you the award then. So yes, you can go back to whatever date this says. So you can bill back for people from June 1st of 2015. You can go according to their dates. Oftentimes you do find out later. I know that's weird. Or the reverse. Maybe you get it today and the budget period does not start until May 1st. You cannot go this weekend and buy everything to be ready to go May 1st because that would be outside the budget period. So you have to make sure you're incurring costs within the appropriate budget period. So the project period is long. The budget period is short, and you want to pay attention to that. You also see how it's divided. You have your salaries and wages, fringe benefits, etc. Those are the money. That's the amount of money that you can spend in each category. Now, we're going to get to some what ifs. Just so you know, with federal grants, you can always move 25% of the federal award from one category to another without approval. Over that, you have to get approval. I will tell you, HRSA, HHS, SAMHSA, they start getting annoyed if you say, can I move $2? I'm going to take $2 from fringe and put that into salaries. Yeah, they don't care. They do not care about that little amount. You start switching and you're going to give up all, and move $200, $200,000, and that's a third of the budget. Yeah, they're going to get upset and you have to get approval for that. We're going to talk about some more what ifs later, but again, this is your guide. This is your contract with the federal government, and you always go back to this. The next page says any requirements that you have. It does the total. It says the requirement. Here's what you're going to get in future years. Pay attention to this. This is what is important. Also, if you have any restrictions or any things that are due, it will have the due dates on scroll back to page 5, 6, or 7. You always, I'm old school, print it and have it. If anything in the grant changes, they will issue a new one of these. This is your important contract. This is how you spend the money. This is where you're allowed to spend the money. It also usually has a person that you can contact and an email, as well as whoever within your organization is in charge. You'll want to pay attention to that, maintain that, reach out with questions. Don't bug them. Don't just try to ask every little thing. I put that I was going to buy a laptop, but now I'm going to buy a desktop. Yeah, they don't care. They do not care. I can guarantee you that. But again, if you're going to make big substantive changes, you need to contact them. Anything else that you need to sign up for, any things that are due, again, go through the NOA. That's how it's going to happen. Here's your SAMHSA NOA. They are a little bit cleaner. And again, it just has, these are the amounts, these are the categories. And then as the later sections, this is what you have to do. This is what's due. It will have every report due and every deadline for the entire period. So right away, as soon as I get an NOA, I go through and put any dates in my calendar for anything, anytime the FFR, the financial reports are due, anytime the work plan's due, or you have to have anything implemented, you'll want to do that. Also, and this goes without saying, actually pull out the grant you submitted so you remember, because if you're like me, it takes months for them to review grants. You forget what you promised, you forget the timeline, pull that out. Sometimes they will change your budget, so don't just go with what you submitted. You have to go with what the notice of award says. End of story. You also, again, should get anything like this with any grant you are awarded, a letter. This is where the money's going. Here's how to do it, and make sure you follow that accordingly.
We just had a good question come. Oh, sorry, go ahead. We just had a good question come in. We had a good question come in. Is the indirect expense category eligible for those adjustments up to 25%, or are there special restrictions on the indirect cost category?
There are special restrictions on the indirect cost category. You have to go back to the notice of funding opportunity and see if that was in fact given to you. If you have one on file, it can be adjusted. And if you requested it and need to change it slightly, you can. But some grants will tell you indirect is only 5%, indirect's 10%. You're still limited on that no matter what. So, you can check that. But again, we're going to talk a little bit more, but within that personnel category, if you said you wanted to hire an RN and instead you hired an MA, or, you said you're going to hire a doctor, but instead you hired a PA, that's fine. It's still within that personnel category. You can adjust salaries accordingly to pay for those people that you have. That's not an issue. Okay. More fun stuff. This is an FQHC SF 424. Every federal agency uses this form. It looks way different for every federal agency. Don't let it hang you up. It's the same budget. It's putting it in a different format. So you usually have like your general Excel budget, then you have your budget narrative, and then you have your budget in this. Make sure you check it and have somebody else check it, not just the person that did it, because you don't know. It's so easy to make mistakes. Within my company, usually something is checked 4 times before it ever gets submitted, these things, because it's so easy to mess up, type the wrong thing. Non-federal share, some grants do require a match or a non-federal share, others do not. That's up to you, and you can manage that accordingly. Most of the time, the SF 424 always says construction, but many times that is not an allowable cost. So make sure to watch, because just because it's on the federal form doesn't mean that it's allowable from the notice of funding opportunity. So again, just pay attention and do things accordingly. And there is a big application guide. There's a link to it. I do go back to that. I probably reference that 2 or 3 times a month, just to check that. And just a note, the federal government updates their forms and guides a lot. I never save them. I always go back and Google them just to make sure I have the most recent version, because they will update things and you don't always know that. So don't go and download that and save it and think, check mark, got that done. No, you want to save the name, and then you want to be able to Google that every time, so you make sure you have the most up-to-date version. Are we having fun yet? Talking about budgets. Okay, what if my project is only partially funded? Oh no, I asked for $100,000. They came back, they're only going to fund me $60,000. This is not a time to be upset. This is still a time to do your happy dance. This is $60,000 you have. So look at your budget and figure out where to cut. Also, hopefully you've padded your budget a little bit. If most of it's in personnel, maybe instead of hiring 2 people, you can only hire 1. But again, that's exciting. Or you hire 1.5 and a part-time person. Try to pull that off. You are not necessarily expected to provide the rest of the funds. You can adjust your work level accordingly. That should not be any problem with any funder. Some places do make you, if they only partially fund you, you have to submit a new budget. Usually the federal government is that way, and most foundations. Some don't care. Again, just pay attention to that. And how do I handle partial funding? You go and spend it just like you would full funding. You want to make sure to put this money to use. 2 or 3 of the worst days in this company have been days I've had to turn back grant money. Those make me very upset. Never turn it back. Find a way to use it. Talk to your funder, have the relationships, make sure you can spend that money and make adjustments as needed. Okay. Oh, I missed, there you go. What if my project changes? If your project changes, you may need to talk to that funder, but again, have a backup program. If you wrote for asthma and all of a sudden you're like, really, we have to address diabetes, or there's an HIV outbreak in our area, really need to address that. Usually most funders will be fine with that. What if my partners change? There are a lot of specifically HRSA Office of Rural Health Policy grants that you have to have 2 and 3 partners. 4 partners, they have to be rural. Make sure they meet the NOFO requirements. If it says they're healthcare partners and instead you're like, well, I'm just going to partner with schools, I'm not doing healthcare organizations, it still has to follow those original rules, but most people will be okay with that. Again, communicate that to your funder. This is a big one right now. What if I can't hire the position I said I was going to hire? That is huge. I wrote for a psychologist. I can't find a psychologist HSPP. I wrote for a doctor. I can't get a doctor. Again, I think people understand, but again, try to hire the best you can. If you wrote a nurse practitioner and you can get a PA, hire that PA today and be thrilled that you have a PA. If you can instead get a licensed mental health counselor and you can't get a licensed clinical social worker, be thrilled that on January 1st, 2024, licensed mental health counselors can bill through CMS and party all day long, okay, in addition to LCSWs. So again, you want to hire as close to the position as possible, but you have to do your best, and we are in a healthcare workforce crisis. Also, there are people that, you can contract with nurses part-time or by contract and things like that. If you're afraid this is just going to be a short-term grant, I had some people do that. They knew it was like a vaccine grant and they were afraid they couldn't keep people on. Well, then hire somebody by contract for those 5 months if you are afraid you can't keep them on. But again, be reasonable and hire the people you think you can hire. And what if I need to move budget categories? As we talked about, for the most part, that's fine, as long as it's within that 25% or below of the total award, not of the category award, of the total award. And if it is a foundation that doesn't allow you to switch, again, that communication and that relationship with that person is going to be key. And for the most part, I've always had positive experiences with allowing people to move that funding accordingly. But again, communicate. And it's also, if you're trying to do the right thing and still carry out your project goals, they're going to be supportive. And here's my contact information. You can feel free to reach out to me at any time. You can also reach out to Hannah. I've loved that you guys have provided questions today, and we'll welcome any more questions in the chat, or you can unmute your line. This is, in my opinion, the most difficult part of dealing with grants. And again, we'll be inviting you to a training later this summer or early fall about, again, grant management, how to track it. I've got my award. Now what do I do? And we'll probably go over some NOA details on that call as well. So if you don't take anything else away, please make sure you pay attention to your notice of awards and your letters from your funders. Keep them in a file and make sure to read every word, because those really are important and vital to your grant success and your organization's success. So again, thank you for joining, and I'll stay on for any questions.
Awesome. Thank you, Elizabeth. And like she said, please either unmute your line or drop it in the chat. I love the questions that came in during this call. We did have one submitted, so I know you touched on it a little bit earlier, but can you explain what it means if a funder requires either a cost share or a match in their grant budget? Yes. So there are times, and it's pretty common anymore, that they do require a match or cost share. And what that means is, I'm going to be easy with my numbers because I'm not a numbers whiz. By the way, this is my other secret to success. I have like a cheap $3 Amazon calculator, which works wonders. I have it at my desk. I've even bought it for different team members because I say you got to have the easy calculator to do everything, because people try to get all fancy and it complicates things. Sometimes old school and simple is better. But if you need a cost share, let's say that the grant's for $100,000 and sometimes cost share is 25%. There are some times that it will say you have to provide that in cash. Sometimes they don't care and it can be in kind. So let's just say that, you're going to do $100,000. You're going to put up a $100,000 dental equipment in a room, and you need match. It may be that your staff could paint the room and could donate
time and energy to set up the dental operatory, and that could be a match for dental equipment. It may be that you have to actually provide cash from your bank account in order to attain that grant. And sometimes, especially with federal grants, you can match with state and local foundation grants. So you can get other grants to match for that. And again, that does depend on your agency. So you have to look at the different rules. Even with USDA, with the rural emergency healthcare grants, they allowed for in-kind matches. And I guess that's not normal for USDA. So there are always different rules with every grant. You want to pay attention to that. In-kind can be people donating time and energy. It also could be, let's say that you're going to pay for half a community health worker out of the grant, and then your organization is going to pay the other half of that salary because they really want that community health worker addressing the diabetes and obesity in your area. That also can be a match. But again, it's usually funding you have or funding you attain in order to gain that larger federal or foundation award. People like the match because they want to have local buy-in. And I will tell you, sometimes even if it's not required, for FQHC new access points, it's not required, but I will tell you, whenever I was a CEO and wrote new access point grants, and I still write them, but for clients, and I encourage my clients to, it looked great when I went and got land donated to put a clinic in a town of 368 people. And I had that proof from that town. They were donating an acre of land that was valued at $8,800 and signed by that local town council. People loved that. And that grant did get funded. So you want to always think about that. Even if it's not required, it may be something that you want to strive to attain to show that that local community is really bought in and wants that service provided. Anything else? All right, well, I'll turn it over to Hannah to wrap us up today. Thank you.
Awesome. Thank you so much. And as mentioned, these slides, and I will also put in this an FAQ sheet as well as the recording will be sent out to your email tomorrow. So with the email you registered, just be on the lookout for that. If you don't receive it, please feel free to reach out to me. And like Elizabeth said, we are expanding our webinar series to go through the summer. We have a variety of different topics already queued up. So if you want to be on that email list and you're not, please email me. All of you that register for this, so you're automatically on the email list. But if you want to share these webinars, please have them reach out to me. I'll get you on our newsletter list so you guys can stay in the loop with these webinars. We thank you so much for your attendance and have a great rest of your day. Thank you.